Wim van Harten, Netherlands Cancer Institute, where I spent 10 very happy years in the 80s. Welcome to eCancer TV, and thank you very much for helping to make the OECI link with eCancer TV happen. You're going to be the next president, and in just ahead of that, we're organising meetings in Amsterdam. And there are a couple that you're involved in. I think you're heading up the lead in the survivorship meeting, and that's in November. Tell us why you're doing that.
Well, it is obvious that more people are surviving after cancer treatment, and as a consequence of the success of the treatment, it is important that survivors are being taken care of properly, and we realize that symptoms and problems after treatment are becoming more important, and they have to be tackled. So in a way, this is a result of our own success that we have to service these people too.
It's nice to have that problem, of course. So who's going to be at this? Is it for patients by patients, or
no? This is
for survivors by survivors, or
first to obtain an overview of activities in Europe, especially. There will also be two well-known speakers from US, Patricia Gans and Melinda Edwin.
Yeah, I know Patricia.
And from various European countries like Denmark, Germany, the Netherlands, of course, and to have first an overview of developments everywhere. We will see what kind of cooperations will follow after that.
And of course, being a National Cancer Institute in the Netherlands, and many of the OECI members are the same, you have a leadership role, don't you, as an institute to lead this sort of activity. You see that happening with the support of the other OECI institutes, or are you doing this because you're just further down the line and you're more
well,
organized?
I think we are somewhat advanced in this field, both in research and in practical services, organizing services, which is not very easy, especially when budget cuts are going on everywhere. But it is an important issue, and of course we hope to stimulate cooperation and exchanging ideas in this way. And to come back to the OECI role, especially survivorship care has not to do just with one profession, but it is also a multidisciplinary field in which especially the institution has an important role to play.
Yeah. And is this going to be something which is going to be fairly up in the front of your presidency when you take over shortly?
Well, this is one of the issues. I think strengthening the position of and the knowledge on how to organize cancer centers, because there's a shift from professionalism towards institutional cooperation in the field of cancer care, and this is a very important development which I would like to foster and stimulate.
I think it's a nice balance, because of course your institute has also been one of the leaders in the Eurocan platform, European Commission FP7 project, which hopefully will start on 1 January 2011, I think. And that's of course more high tech, and there will be platforms across the industry, and indeed there's an OECI meeting in Amsterdam on molecular pathology, which presumably will be also linking up some of these institutes.
In March next year.
Well,
especially my colleague Tom Burns is very active in the Eurocan platform, but myself, I am involved in a next stage in accreditation, being accreditation or designation of excellent cancer centers, which is the next stage in trying to build up the system of comprehensive cancer care in Europe in a bottom-up way, because that's the only way we can do it.
And it's a very Dutch way of doing things, and it's always worked for Holland, and you do everything better, as I well know now.
Well, it has to, we have to show it, but we have a good chance, I think.
Then thanks very much indeed, and we'll look forward to seeing you in November in Amsterdam. So,
thank you very much.